Welcome. If you guys can hear me, leave a message, shoot a message. But this is Dr. Isang using this platform to be able to talk about heart health and prevention. And one of the biggest things that we see in the hospital, one of the things that we see in the office is chest pain. So when someone comes to me with chest pain, what are the things that I look at? What are the things that concerns me sometimes that makes me want to either ask further questions or get further information, whether it's through the history, whether it's through labs, whether it's through imaging to further delineate whether your chest pain needs serious intervention or what else can be done for it. So, what is the classical symptoms or what is the classical presentation for chest pain or cardiac chest pain that gets me concerning as a cardiologist? You have chest pain here in the mid-sternal location. It can sometimes travel to the shoulder, to the jaw, but mid-sternal pain that is worse with exertion, such as walking a certain distance, hiking, a flight of stairs, pains that get worse with stress, but also pain that gets better with rest or medication called nitroglycerin. If you have those three symptoms, the chest pain here, pain that's worse with exertion, and pain that gets better with rest or nitroglycerin, I am concerned that you have all three cardinal symptoms. We should get further testing to make sure that your pain is not due to a heart attack, it's not due to blockage, atherosclerosis. There's many different definitions of it, many different ways that it can be labeled. So, what can we do when you're having that pain? Number one, call 911, go to the hospital. Don't try to drive because what if you are having a heart attack and on your way driving, you crash your car, something bad happens, or you even pass away? So, call 911 is the best thing. If you do not want to do that, if you have someone who can drive you, ideally dead over you driving yourself, in the hospital, you're telling them that you have chest pain. Workup that's going to include is an EKG and electrocardiogram to look for potential blockage or electrically. So look for changes that are concerning for someone having a blockage. Also get blood tests called a troponin. This is released from the heart when it's under stress. Caveat is that you have to utilize it for the right reasons. A lot of times people will check this blood test inappropriately and get abnormal results and consult cardiology. So if someone is in a serious injury, such as a gunshot wound, such as a motor vehicle accident, if you check that blood test, is going to be elevated. It can be released under stress, infections, blood loss. But if you're having chest pain and that test is checked and it's elevated, then boom, concerned that you may be having a blockage, potentially a heart attack, potentially complete occlusion of that artery. So for those individuals, we send them to the cardiac catheterization lab to look for blockages. We use either the artery in the wrist or the artery in the groin, take a long catheter and go all the way into the heart, taking pictures with contrast. Contrast is important because sometimes people can have kidney issues and um, if you utilize too much contrast and if they have significant kidney issues can lead to them needing temporary or even permanent dialysis. But if there's blockage, we put a stent in to open it back up, or we consider open heart surgery, coronary artery bypass surgery, also known as cabbage. So those are for people who meet every single criteria. They have the classic chest pains, they have the EKG findings, and they have the blood test to all match up. Boom, everyone goes straight forward to a cardiac catheterization. Now there are some individuals who don't have those classical symptoms. They can have maybe some chest pain or even shortness of breath, shoulder pain. Their blood test may not be positive and their EKG may look normal. So what else can you do to further risk stratify them or to rule out who needs to be treated urgently or even emergently? In addition to the EKG and blood test, you can check troponin. You can check an echocardiogram, an ultrasound of the heart. You can imagine that if certain parts of the heart is not getting enough blood flow, that area is not gonna squeeze as much. It's gonna be a little bit weaker. You can do a stress test. The majority of people, we are doing a stress test to make sure that there isn't any indirect concerns for blockage. If there is, then we will once again proceed with a cardiac catheterization to make sure that there's no blockage. Unfortunately, there's a lot of people who have a normal stress test and can have a normal echocardiogram for these individuals. We will follow them up on an outpatient basis to make sure that there isn't anything else that can be causing this chest pain, because chest pain is not always the heart. It can be your pancreas, it can be your gallbladder, it could be your intestines, it can be the bone on your chest that is inflamed. It can even be anxiety. It can be a pneumonia. So if the cardiac workup has ruled out the life-threatening issues, then we follow up outpatient, ideally with primary care, primary provider, to make sure that there's no other underlying etiology that can be causing your chest pain. Going to take this moment to answer a few questions if anybody may have. If not, I'm going to be out of here. Dr. Isang here to talk about heart health prevention. Today we were talking about chest pain. Recap: pain here, pain that gets worse with exertion, pain that gets better with rest or medication called nitroglycerin. Go to the ER, check labs, check EKG to look for electrical abnormalities. If everything lines up, cardiac catheterization to look for blockages. If everything does not line up, then either an echocardiogram to look for any areas of the heart that's not squeezing appropriately, or a stress test. If those are abnormal, cardiac catheterization. If everything is normal, follow up outpatient. We will, look for other potential causes, issues with the pancreas, with the gallbladder, with the intestines, with the lungs, sometimes even anxiety, sometimes the chest wall cavity. Chest pain in under 10 minutes. Now, here's the 30 seconds if I can help anybody with any questions possible before I head off. All right, there were no more questions. Hope you guys have an amazing weekend, amazing Friday. And, once again, the importance of all of this is to know that prevention is a lot better than treatment. So if you understand these things to look out for, this case was more or less looking out for, chest pain that can be concerning for a heart attack. But in general, if you can understand what the symptoms of, what the risk factors for heart disease are, and you treat those risk factors, you could potentially prevent a heart attack, prevent a stroke, prevent the end stage kidney disease. So watching out for things like diabetes, high blood pressure, high cholesterol, knowing what your family history is, because there are some genetics associated with it, smoking, but most importantly, following up with your primary medical provider.